The scars from our childhood and adolescence, both visible and invisible, shape the rest of our lives in ways we do not yet understand. Our early experiences, whether traumatic or not, play a crucial role in our development, influencing not only our mental but also our physical well-being. Welcome to my TED Talk. My name is Autry, and my research question was, what are the impacts of childhood trauma on an individual, and what are the most effective therapeutic methods to alleviate these impacts during and after trauma? So what is trauma? Trauma is when an individual of any age and at any point in time experiences something that is stressful, distressing, or frightening and finds it difficult to cope with the experience. PTSD is a syndrome that occurs after a person has experienced a traumatic event or a series of traumatic events that has led to intense fear, hopelessness, abandonment, or terror. Now, these traumatic events can either be exposure to severe danger, violence, or abuse. The adverse childhood experiences, also known as ACEs, is one of the largest childhood, adolescent, and abuse, as well as neglect and household dysfunction investigations in the world, and has paved the way for trauma research and studies all across the globe. It has also developed the method of how we use to measure trauma, known as the ACEs test. Now, this is a 10-question questionnaire that determines your exposure level to traumatic events. Now, the higher the score, the higher chance of you having a negative health outcome, and vice versa. The lower the score, the lower chance of you having a negative health outcome. Now, this is an important research question to me because I really wanted to understand how trauma affects and impacts an individual throughout their life. I did it to hopefully better understand how my own experiences have impacted me, as well as to better understand how others' experiences have impacted them. Because I've been through so much in my life, and there are so many people that have been through just as much as I have, if not more, and yet we are so vastly different, and I really wanted to understand why. I picked this research question to not just better understand my own way, but to help others see how their own experiences have shaped them, but to also let them know that it doesn't define who they are, and they can choose a different path. So the impacts of trauma affects individuals at many levels of functioning, cognitively, somatically, emotionally, behaviorally, and characterologically. And now we're going to jump into the deep impacts of trauma on the brain. Trauma affects many brain systems. One of those is brainwaves. So brainwaves are the electrical activity in the brain that are important for all elements of cognitive functioning. Now, these can be thoughts, emotions, behaviors, and focus on and overall cognitive functions. Now, each wave controls something different. So your delta wave is going to control your sleep or not fully sleep, but kind of when you're falling asleep and just that beginning stages of relaxation or unconscious processing. The next is going to be theta. This is going to focus on your deep sleep or de-relaxation, also known as REM sleep. If you've ever looked at someone when they're sleeping and their eyes are closed but their eyes are still moving under their eyelids, that's also known as REM sleep. The next one's going to be alpha. This is going to focus on your creativity, your flow, as well as your concentration. The next is your flow and your creativity. The next is going to be beta. This one focuses on your concentration, as well as your active thinking and your awareness of your surroundings. And lastly is going to be gamma. This is going to focus on your multiprocessing, as well as your high-level cognition and decision-making. Additionally, delta, theta, and alpha waves focus on consolidating your self-related memories, as well as your referential thought and memory retrieval, whereas beta and gamma is going to focus on your self-awareness, your cognition, and your social and your consciousness. It's actually proven that trauma affects your brainwaves and can cause abnormal brainwaves. A study done on childhood abuse and neglect associated with abnormal brainwaves found brainwave abnormalities in 54% of patients with a history of childhood trauma. Now, trauma with brainwaves can impair many levels of functioning for an individual. As I mentioned previously, it can affect their sleep, their focus, their behaviors and emotions, and their cognitive functions. Now, this image is going to show your normal brainwaves, your abnormally small, which is going to be when you're concentrated or focused on something, as well as your abnormally large. This is going to be when you're relaxed and in deep sleep. So brainwave abnormalities could just be you experiencing abnormally small brainwaves at the wrong times, like when you're relaxed, or abnormally large brainwaves when you're supposed to be concentrating. Next system that trauma affects is your default mode network. Now, your default mode network is a collection of interconnected brain regions that internally focuses on your thoughts, your feelings, your self-reflection, and it allows us to reflect on our social interactions throughout the day, as well as even plays a role for an individual envisioning their future. Now, it's active for self-referential thought and autobiographical processing, which is thought to provide an individual with a stable foundation for a sense of self. Now, having a stable sense of self can help an individual combat the mental and physical effects of trauma by helping them create a cohesive self-narrative. Now, PTSD participants in a study showed substantially reduced resting state functional connectivity in the DMN, meaning that individuals were not either fully processing their emotions, thoughts, or actions throughout the day, or they just were not processing them correctly. Next, we're going to move into the limbic system. Now, the limbic system is important for emotions and behavior regulation as well as memory. It's also very susceptible to harm and damage. It's directly connected to your endocrine system, which is the system that's in charge of producing hormones like dopamine, norepinephrine, and cortisol, also known as the stress hormone. For this next part, we're going to focus on the hippocampus and the amygdala. The hippocampus's job is to focus on memory retrieval and formation of both verbal and emotional memories, as well as it plays a role in how an individual learns and adapts to its environment. The hippocampus develops slowly through infancy and adolescence, and is one of the only brain regions that continues to develop neurons after birth. It's very susceptible to harm, especially by cortisol, and cortisol can actually significantly change the shape of the largest neuron in the hippocampus and even kill surrounding neurons. Now, neurons are the informational messengers in the brain and body, and when neurons are damaged, it can cause synaptic loss. Now, synaptic loss is when the electrical brain signals are not correctly passed from one nerve cell to the other. Now, research has found that synaptic loss causes neurological damage in the hippocampus, the amygdala, and the prefrontal cortex. Now, this can lead to changes in memory, cognition, emotional and behavioral regulation, as well as decision making. Next is the amygdala. The amygdala focuses on processing incoming sensory information. Now, it can be it receives this information in the context of the individual's survival and emotional needs to help initiate appropriate responses. The amygdala is also very susceptible to cortisol, and it can actually overstimulate the GABA receptors in the brain, which are chemical messengers that help the nervous system maintain homeostasis. GABA plays a crucial role in regulating behaviors and emotions, and research has shown that excessive exposure to this can cause excessive neuronal firing, which is tied to anxiety and depression disorders. Now, trauma affects individuals somatically and cognitively. We just went over the big effects that trauma has deep in the brain, and now we're going to broaden that to how it affects an individual's day-to-day lives. Some of those effects are somatic effects. This is going to be the physical effects. Now, there's very limited information on the somatic symptoms and somatic effects of trauma just because the research isn't there and they don't have the data for it. But the most mentioned that I found were night terrors, hypervigilance, hyperactivity, and amnesia. Now, these symptoms can affect an individual's daily functioning, affecting their social, emotional, and academic well-being. The next are going to be these cognitive effects. Now, everyone experiences trauma differently, and everyone's going to have different cognitive effects because not everyone is the same. The most common ones I found were depression, anxiety, impulsiveness, PTSD, suicidal thoughts, and substance abuse. Research has shown that approximately 75% of individuals with trauma have substance abuse disorders or have used substances to cope in the past. I myself have used substances to cope in the past and have struggled with alcohol and weed as using it as a negative coping mechanisms to deal with what was happening around me. I've made a lot of those mistakes in my life, but I didn't let those mistakes define who I was or my path, and instead let myself grow from them. And I think that it's possible for any individual to grow from these mistakes and grow from these negative habits, but part of that is them getting the information out there about how trauma impacts them and affects them. How it's very important that they understand the impacts of trauma so that they can hopefully avoid substance abuse or they can avoid negative coping mechanisms to deal with their traumas. Now we're going to move into effective treatment methods for trauma. Now, the most effective one that I found was TFCBT, or trauma-focused cognitive behavioral therapy. Now, this works by changing an individual's thinking patterns and behavioral patterns. It helps the individual understand the problem while developing a solution. It essentially helps them process the traumatic memory while developing a healthy coping strategy. Now, they did a study with 4,523 participants, and they discovered large improvements from pre-treatment to post-treatment compared to a control group. The post-traumatic stress symptoms in the control group showed improvement from 1.14 to 1.30 after only 8 sessions. And these sessions are 60 to 90 minutes. Whereas it was compared to other treatment methods and or not doing anything, and those improvements were from 0.52 to 0.73. Now this is showing that there is a very large increase for improvement from TF-CBT versus those other treatment methods, as well as just helping reduce the post-traumatic symptoms that are caused from trauma. Now this here is a graph that you can see that shows pre-waitlist, pre-assessment, pre-therapy, post, and then follow-up. And this doesn't exactly correlate with the data that I have just said, but it does show that there is improvements and that trauma-focused cognitive behavioral therapy does work over time to improve. It has also pointed out in my research that it is effective not just for that singular time or moment, but it's effective for years after as well, even if the treatment stops. The next method is going to be EMDR. Now this is eye movement desensitization therapy. This study there was a study done by the National Institute of Mental Health Research, and this used 88 PTSD subjects. And this showed 91% effectiveness of reduction in PTSD symptoms after 8 sessions compared to fluoxetine, a common known antidepressant, which only showed 72% reduction after 8 weeks. Now this also follows the same or a similar structure as TF-CBT, as it gets the individual to reprocess those traumatic memories in a safe and controlled environment, as well as helping them rechange those thinking and behavioral patterns. Now, as you can see in this graph, it shows the effectiveness of EMDR in different people. So in veterans, it's after 12 sessions, sexual assault victims, it is shown this much, which is very surprising compared to TF-CBT, which is very, very effective in sexual assault victims, showing a 99% success rate. The next one is going to be multiple traumas suffered. This is 77%, but it is shown to be 100% effective in reducing PTSD symptoms or simply getting rid of PTSD symptoms with people that have only experienced singular traumas. And I believe that this is because it helps the individual work through the traumas and process them in a way that they feel comfortable and safe, so it leads to less setbacks. And treatment methods. There are more treatment methods that I have not mentioned. There's medications like antidepressants and anti-anxiety medications, as well as mindfulness, yoga, there has meditation, and there are many other general therapies that people have used. This wasn't the sole focus of my research, so I didn't do a ton digging on how effective these treatment methods are, but I have used some of these treatment methods in the past and they have worked for me, and I know many others that have used these treatment methods and they have worked well for them as well. I just simply don't have the data to back up this information to show how effective it is, but that's not saying it isn't effective, I just don't have the evidence to prove it. And finally, I want to leave you guys with reiterating what I said in the beginning, that I started this research to better understand myself and how my own experiences have shaped me and impacted me. But through this research, I have really found that drive to help others so they can see how their experiences have impacted and shaped them. That it's not just your experiences that have defined you, and it's not just your mistakes that make you who you are, that you can grow from that, and they don't define who you are. I believe that change is possible and that everyone deserves the chance to thrive no matter what they've been through. And I think it's very important that research on this topic continues, because there are so many unanswered questions with trauma and the effects on the mental and physical well-being of people. There are so many unanswered questions through my research that I've found, like how effective treatment methods are for individuals with specific types of traumas or PTSD. And I just think that it's very important for individuals to get this information and that we have more research on effective treatment methods so that everyone gets the help and the care that they deserve. And with that, I want to say thank you guys for coming to my TED Talk.